Hi, my name is Christina Dickey, and I'm going to be your student physical therapist today. Today we have a patient who is a 22-year-old female, and she suffers from a triangular fibrocartilaginous complex lesion about 2 months ago, and that's going to be located on the ulnar side, so the best bet for that is going to be ultrasound. Today we're going to be using ultrasound in order to facilitate the healing process and decrease the pain, because she said the pain is probably a 6 out of 10 when she goes back into playing sports.
Bodies in the sand, tropical drink melting in your hand. We'll be falling in love to the rhythm of a steel drum band down in Cocoa.
So before we begin with ultrasound, we're going to need to cover the contraindications and precautions. First, I'm going to ask the patient a few questions, and that will be, do you have cancer or any history of cancer? All right, have you ever had a laminectomy?
No.
Okay, do you have a pacemaker?
No.
Are you pregnant?
No.
All right, do you have any blood clots?
No.
Okay, and have you ever had a joint replacement?
No.
All right, and there's 2 other contraindications, which would be no ultrasound over the eyes or no ultrasound over the reproductive organs. So that's not going to be an issue in this case.
Afternoon delight, cocktails.
Next, you're going to want to cover the precautions. If there's an acute inflammation in that area, you're not going to want to do it. Well, you can do it, but it just has to be a non-thermal ultrasound. The next one is if they have epiphyseal plates, and that's usually a problem if they're children, if they have a fracture in that area, or if they have any breast implants. Step is to make sure your patient is in a comfortable position. The best way with this is to have her sideline, because we're going to be on the ulnar side of her hand, and if she was seated, it'd be kind of awkward. So that's that. And then we're going to go ahead and set up the machine. First step is making sure your machine is on. After that, if you look at the screen, you have the option for electrotherapy, ultrasound, combinations. But of course, we want ultrasound. So we're going to hit ultrasound. Wait a few seconds. Edit your parameters, and since for a TFCC lesion it's going to be superficial, so we want the frequency set to 3 megahertz. Change that. We also want to be relieving her pain, and since it's not acute, we can go ahead and do 100% continuous for the duty cycle. And as far as treatment time goes, it's between 5 to 10 minutes, so I would probably start out at 6 or 7. For the intensity, since it's at 3 megahertz, we're going to have it set to 0.5 watts per centimeter squared. So now that that's set up, we can go back to her hand and apply the gel. You want to make sure the entire area is covered. Alright, and if we had an alcohol swab, we'd be cleaning this off. And I'm going to apply it, move the gel around a little bit. And you can go ahead and press start. So while you're doing this, you're going to make sure the head stays on the entire time. Make sure you cover the entire area, and make sure there's always gel underneath. And you have to keep it moving because you don't want to burn the patient's skin or anything. Always ask for the patient's feedback while you're doing it. And so this is going to continue for about 5 to 10 minutes, and afterwards we're going to stop it. Clean the area up. Assess the area. Looks good. And ask for patient's feedback whether the pain decreased, but the expected outcome is that it will decrease It might not be so much, but with further treatments, it could.
A little